Welcome back to Breastfeeding Nurtured, All You Need to Know. In our last session on expressing and storing breast milk, we explored the right techniques for expressing and safely storing breast milk. Today, in session 4B on breastfeeding the first hour after birth, we will discuss effective ways to initiate breastfeeding within the first hour after both vaginal and cesarean births. Previously, we covered baby positioning in session 4, perfecting the art of positioning and latching. Based on audience feedback, many of you wanted to learn more about how to support mothers during the crucial first hour after birth. To address this need, we have now divided the content into two parts. Session 4A focuses on positioning and latching fundamentals, whereas Session 4B, newly added, provides a deeper step-by-step guide to help mothers during this critical early breastfeeding window. Before we dive into the first slide, don't forget to subscribe to my channel by simply scanning the QR code. Stay informed with the latest breastfeeding best practices. Don't miss out. Join us today. So let's get started with our first slide. Let's explore the significance of timely breastfeeding initiation and discuss how healthcare providers can support mothers across various birth scenarios through the following learning objectives. Why breastfeeding matters, or why we need to start breastfeeding within 1 hour after birth. What is the current status of early initiation? We will be comparing it with the number of institutional births as well. How to support mothers to breastfeed within first hour after vaginal or cesarean birth. What are the reasons for delayed initiation and how we can ensure early initiation of breastfeeding. As discussed in detail in session 2, colostrum offers essential nutrients and robust immune protection for newborns. In session 8, we emphasized its critical role for preterm infants as a vital first feed, helping to strengthen immunity, promote intestinal development, and prevent complications such as sepsis. We will not revisit the benefits of colostrum as they have already been covered in detail. Let's now move forward to the next slide. We also discussed in session 1 that early initiation of breastfeeding within first hour after birth plays a critical role in reducing neonatal mortality, potentially preventing up to 22% of neonatal deaths. Delayed initiation significantly increases the risk of neonatal mortality, underscoring the life-saving impact of timely breastfeeding practices. Another important aspect to initiate early breastfeeding is the strong natural sucking reflex, which plays a crucial role in effective feeding. In next slide, we will explore how to utilize it for optimal breastfeeding success. Referring to session 8 once again, we learned that babies from 28 to 31 weeks of gestational age may begin opening their mouths, moving their tongues forward, and making licking movements. However, suckling remains ineffective. From 32 to 34 weeks gestational age, they start rooting, attempting to attach to the breast, and may suckle weakly. From 33 to 35 weeks gestational age, babies can root more actively and engage in organized suckling, effectively taking milk from the breast during brief periods. Breastfeeding can cover part of their intake, but cup feeding or other alternatives are needed to ensure adequate nutrition. Further, most babies with gestational age 34 to 36 weeks can coordinate suckling well, though some feeds may still require cup feeding. But most babies beyond 36 weeks gestational age are ready for full breastfeeding and can meet their nutritional needs directly from the breast. Sucking reflex in these babies is naturally strong, This instinctive behavior plays a crucial role in effective breastfeeding, which we will discuss further in the next slide. Early initiation ensures that the strong reflex is put to immediate use, maintaining the baby's feeding competency and promoting sustained breastfeeding success. Early exposure helps infants to maintain and develop coordinated suck, swallow, breathe pattern necessary for efficient feeding. The more the infant suckles, the better the feeding reflex develops and the stronger the breastfeeding relationship becomes over time, thereby resulting in optimal milk transfer from the mother to the baby, which is essential for the growth and development of the infant. It stimulates continuous breast milk production by triggering hormonal responses in the mother, thereby enhancing milk production and supply. Breastfeeding, if delayed, weakens the sucking reflex, leading to difficulties in latching and effective feeding, which can affect both nutrition and bonding. Now again, as discussed in session 8, for preterm babies who are not yet breastfeeding directly, non-nutritive sucking like using a clean finger can help develop the sucking reflex earlier, preparing them for effective breastfeeding. Even during tube feeding, the mother can allow her baby to suck on her finger, which is believed to stimulate the baby's digestive tract and support weight gain by promoting gut motility and feeding readiness. The mother must wash her hand thoroughly before offering her finger for the baby to suck on. Next, we will explore the current global status of breastfeeding initiation. The rates of early breastfeeding initiation show considerable variation across regions, ranging from 32% in the East Asia and Pacific to 65% in Eastern and Southern Africa. Globally, the initiation rate is merely 42%, meaning that only 2 in 5 newborns are breastfed within the first hour of life. Interestingly, no data is available for North America and Western Europe, highlighting a significant information gap in many high-income regions. Even within countries, substantial disparities exist, which we will see in next slide. Taking India as an example, the national average for early initiation stands at 41.8%, but state level rates fluctuate between 21.5 and 78.8% as shown in the table. We will discuss the reasons behind these differences later. Although early initiation rates cannot be determined for most high income countries, data on children who have never been breastfed is available. In these countries, 21% of children never receive breastfeeding compared to just 4% in low and middle income nations. The significant disparity translates to 2.6 million children in high income countries missing out entirely on the benefits of breastfeeding. Additionally, the lack of estimates for North America and Western Europe underscores a concerning information gap in many affluent regions. While institutional deliveries have increased significantly, the expected rise in early breastfeeding initiation has not kept pace, highlighting a crucial gap in postnatal care. Let's have a look at the key trends. The percentage of births occurring in healthcare facilities rose from 53% in 2005 to 71% in 2017 across 58 countries with available data. However, despite more institutional deliveries, the rate of early breastfeeding initiation increased only from 45% to 51% during the same period. The data indicates that hospitals and birthing centers are not fully utilizing the opportunity to support immediate breastfeeding post-birth. Let's examine recent data specific to India. This graph highlights the relationship between institutional deliveries and early initiation of breastfeeding in the highest and the lowest performing Indian states for institutional births. Institutional births vary from 75.8% in Jharkhand, the lowest, to 99.8% in Kerala, the highest. However, the corresponding rates of early breastfeeding initiation are significantly lower at 21.5% and 66.7% respectively, underscoring a critical gap in immediate postnatal care. On average, India records 88.6% institutional births, yet the early breastfeeding initiation rate remains at 41.8%, indicating a significant gap in postnatal breastfeeding support. This disparity highlights that a higher number of institutional deliveries does not necessarily translate to timely breastfeeding initiation. Now let's examine the impact of cesarean sections on early initiation of breastfeeding. Globally, the rate of C-section has risen from 13% in 2005 to over 20% in 2017, posing a significant challenges for timely breastfeeding initiation. C-section use continues to rise, now accounting for more than 1 in 5 of all childbirths. This number is set to continue increasing over the coming decade, with nearly a third, that is 29% of all births likely to take place by C-section by 2030. A study across 51 countries revealed that newborns delivered vaginally were more than twice as likely to begin breastfeeding early compared to those born via C-section. This pattern was consistent in almost all countries, with statistically significant differences in 47 out of 51 nations, highlighting a crucial gap in postnatal breastfeeding support. Breastfeeding is a journey that begins before birth. Learning and preparing during pregnancy can make breastfeeding smoother and more successful. Prenatal breastfeeding promotion or education should start during pregnancy. Learning about its benefits and importance helps mother feel confident and prepared. When breastfeeding is seen as the normal way to feed a baby, mothers are more likely to start and continue successfully. Antenatal education should be part of a comprehensive support program that continues after birth. Mothers should be consulted at every prenatal checkup, visit, and receive guidance on breastfeeding. This should include why breast milk is superior to formula, how breastfeeding works, and what to expect in the hospital after delivery, such as skin to skin contact and early latching. Understanding the risks of unnecessarily formula supplementation also empowers the mother to make informed feeding choices. Identify and address challenges which may make breastfeeding harder, such as flat or inverted nipples, previous breast surgery, or hormonal issues. Early discussions will help healthcare providers to offer personalized guidance. Knowing what to expect and how to handle difficulties will reduce anxiety and initiate early breastfeeding successfully. Patient-centered education should be clear and easy to understand, preferably in her own language and culturally appropriate. Including family members in discussion helps create a strong support system, making it easier for the mothers to continue breastfeeding. Suffice to mention that prenatal breastfeeding education plays a crucial role in preparing mothers for successful breastfeeding. Research also shows that prenatal breastfeeding education enhances knowledge, promoting earlier initiation. Let us now come to the practical aspect of initiating early breastfeeding after vaginal delivery. I will not go into the resuscitation details at birth. In short, once the baby is received in warm linen and placed prone on the abdomen of the mother, ensure that airways are open and the newborn is breathing well or crying. The cord is clamped and cut between 1 to 3 minutes. The baby is then gently placed between the mother's breast for immediate skin to skin contact. Always keep the newborn dry, well covered, and clear of any visible secretions. If left wet and uncovered, they may struggle to breastfeed, become weak, and face a higher risk of infections. The mother should be encouraged to kiss, cuddle, and hold the baby close, ideally within the first 5 minutes to promote early breastfeeding initiation. This breast crawl position helps initiate breastfeeding within the first hour. Various breast crawl videos on YouTube can help to guide this practice. Offer assistance to the mother to get the baby well positioned and attached, especially with the early feeds. She may have difficulty in lifting and holding her baby. Make sure someone is always available to help. A relative or friend can do this when there is a shortage of staff. Reiterating, initiate breastfeeding through skin to skin contact immediately after normal vaginal delivery once the baby is breathing well. Encourage the mother to stay skin to skin with her baby as much as possible. Let's now explore the steps for initiating early breastfeeding after a cesarean birth. Once it is confirmed that the newborn is breathing well or crying, the next step is to begin breastfeeding right in the operating theater. Place the baby skin to skin with the mother immediately after birth if possible. Even brief contact is beneficial. Support the baby to start feeding as soon as it shows signs of readiness, even if the mother is sedated. Help the mother find a comfortable feeding position as shown in the picture. To make breastfeeding easier, positions like over the shoulder or foot per hold may require additional support in lifting and holding the baby. Ensure that the baby is well positioned and attached, avoiding pressure on the stitches, especially during early feeds. Listen to the mother and acknowledge her experience for emotional support and help rebuild confidence in her body's ability to nourish her baby. Ensure that a trained healthcare provider, staff member, or a designated support person is always present in the operation theater to assist with the early initiation of breastfeeding. Summarizing, delivering a baby by cesarean section is not a barrier for initiating breastfeeding within an hour of birth. Before moving forward, let's take a closer look at addressing the challenges associated with initiating breastfeeding after a cesarean section. These challenges stem from multiple factors and can significantly influence a mother's infant feeding choices. Common barriers include restricted mobility following surgery, post-operative pain, and the need for continued medical care related to complications that may have necessitated the cesarean section. Additionally, limited support from healthcare professionals and partners, particularly during nighttime hours, often leads to increased supplementation with artificial milk. A lack of understanding regarding breastfeeding physiology and newborn feeding behaviors further impacts a mother's decision to breastfeed. The acronym PRESS has been introduced as a structured approach to supporting mothers in postnatal wards who may feel hesitant to seek assistance with breastfeeding. Let's analyze the acronym. Prepare mothers for cesarean section by providing targeted antenatal education on breastfeeding challenges and strategies specific to post-cesarean recovery. Relieve post-surgical pain to facilitate early breastfeeding initiation and sustained breastfeeding success. Educate mothers about lactation physiology and the significance of nighttime breastfeeding. Additionally, train healthcare providers on the impact of pain management on breastfeeding frequency. Stimulate breast milk production by encouraging regular breastfeeding sessions, including overnight feeds, while highlighting the risk of artificial milk supplementation. Success in achieving exclusive breastfeeding for the first 6 months among mothers who wish to breastfeed after a cesarean birth. By implementing the PRESS strategy, healthcare providers can help mothers overcome these behaviors and improve breastfeeding outcomes following a cesarean birth. It's important to monitor the babies closely during skin-to-skin contact to ensure their safety while recognizing early feeding cues such as rooting, sucking movements, and hand-to-mouth actions. Assist the baby in latching as soon as they show signs of readiness. This timely approach supports successful early breastfeeding initiation and enhances bonding. While doing so, it is essential to monitor the baby's well-being. Ensure the baby's positions allow for a clear airway, observe breathing patterns, chest movement, and listen for any unusual sounds. Check baby's entire body for any color changes as the limbs may show early signs of discoloration. The baby should appear active with good muscle tone, not limp or unresponsive. Keep the baby warm to maintain a stable body temperature during skin-to-skin contact. While supporting early breastfeeding, the following points should be kept in mind to ensure a smooth and successful start. Maintain calm and quiet environment by minimizing the noise and distractions to create a relaxed setting for the mother and baby. Check the mother's comfort by asking the mother how she feels physically and emotionally. Encourage the mother to express any concerns about breastfeeding, pain, or difficulties she is experiencing and provide appropriate support and solutions. Assist the mother to find a comfortable feeding position for good latching. Ensure that the baby is well supported and aligned to facilitate a deep latch. Observe a feeding session to assess effectiveness. Watch how the baby latches and sucks to ensure proper attachment. Provide guidance on the key aspects of breastfeeding like feeding on demand. Explain that newborns should be fed whenever they show hunger cues rather than on a strict schedule. Teach mothers to recognize signs that the baby is ready to nurse. She should be able to identify signs like rooting, hand to mouth movements, and increased alertness. Reassure the mother that frequent feeding stimulates milk production and explain the natural transition from colostrum to matured milk. Encourage the mother to ask questions or concerns and clarify doubts. Provide practical solutions to common breastfeeding challenges, if any. Also offer emotional support to boost the mother's confidence in her ability to breastfeed successfully. Now, let's take a closer look at the reasons behind delayed initiation of breastfeeding before exploring effective strategies to overcome these challenges. Introducing bottles or pacifiers before establishing breastfeeding can cause nipple confusion, hindering proper latching and effective breastfeeding. Family beliefs and cultural practices greatly influence breastfeeding. If elders favor formula or find breastfeeding inconvenient, they may discourage it. Traditions like feeding honey or sugar water before breastfeeding can delay colostrum intake, impacting early nutrition. Lack of awareness of early breastfeeding benefits may delay initiation as mothers may not prioritize skin to skin contact after birth. In some cultures, colostrum is wrongly believed to be harmful or dirty, leading mothers to discard it and wait for white milk, depriving babies of vital early nutrients. Many mothers fear low milk supply early on. Seeing little milk, they may assume insufficiency and unnecessarily supplement with formula. Routine practices like nursery stays or unnecessary procedures can delay breastfeeding. Post-cesarean recovery may also hinder early breastfeeding, leading to formula use. Caesarean sections, excessive use of pain medications, or prolonged labor interventions can delay breastfeeding. For example, a heavily sedated mother may struggle to breastfeed immediately. Some hospitals routinely offer newborns formula or glucose water as a standard practice, delaying exclusive breastfeeding. If hospitals or healthcare providers do not prioritize early breastfeeding support, mothers may struggle to initiate breastfeeding. For example, in a busy ward, nurses may be too occupied to assist with proper latching. Lack of breastfeeding knowledge among healthcare workers or family can hinder early breastfeeding. An unskilled nurse may suggest formula instead of assisting with latching. Addressing these barriers through education, supportive hospital practices, and increased family awareness can significantly improve early breastfeeding initiation rates. These challenges can be broadly categorized into three key areas. First, the family and community factors, in which the partner or family beliefs, cultural traditions, misconceptions about colostrum, and pre-lactal feeding can hinder early breastfeeding. Secondly, the birthplace or hospital practices significantly impact when breastfeeding begins. Routine mother-baby separation, unnecessary formula supplementation, and rigid hospital protocols can disrupt early skin-to-skin contact and breastfeeding. Thirdly, the knowledge, attitudes, and skills of healthcare professionals directly affect breastfeeding support, as lack of proper guidance, misconceptions about milk supply, and inadequate lactation support can lead to unnecessary supplementation or delayed breastfeeding. The primary cause of delayed initiation of breastfeeding often stems from family or community influences, including cultural beliefs, family traditions, and misinformation. To overcome these barriers, a multifaceted approach involving education, community engagement, and support from health workers is essential. Workshops, videos, and illustrated pamphlets can help families understand the benefits of early breastfeeding while respecting traditions. To further strengthen the acceptance of early initiation of breastfeeding, engage religious and cultural leaders, share real life testimonials, and counter myths like discarding colostrum. Early registration of pregnant women ensures structured breastfeeding education during antenatal care, fostering informed decision making. The major cause of delayed breastfeeding initiation often lies within the hospital or birth facility. Implementing and strengthening the baby-friendly hospital initiative can help by training maternity staff to assist with early breastfeeding, enforcing policies to prohibit formula and bottle promotion, promoting 24/7 rooming in to keep mothers and babies together. We will also discuss about baby-friendly hospital initiative, that is BFHI, in detail in a later session. Supporting breastfeeding after cesarean births by enabling skin-to-skin contact and early latching in the operating room or recovery area. Availability of round-the-clock lactation support services, which should be an integral part of hospital settings to create a breastfeeding friendly environment. Key implementing strategies to enhance breastfeeding support and promote successful practices at birth facilities include conducting workshops and training sessions to equip hospital staff with skills for supporting breastfeeding initiation, developing educational videos to demonstrate techniques for early breastfeeding, rooming in and post-cesarean section feeding, and utilizing printed pamphlets and posters to display breastfeeding friendly messages in the maternity ward. Let's now explore how to address the third key area by empowering healthcare professionals to promote early initiation of breastfeeding. Specialized training of all hospital staff, including doctors and nurses, should be ensured for better antenatal counseling of pregnant mothers and to support early breastfeeding initiation after both vaginal and cesarean births. For long-term impact, it should also be integrated into medical education curriculum. Skill training on early initiation, colostrum benefits, positioning, and effective counseling should be imparted to grassroots health workers, including accredited social health activists, auxiliary nurse midwife, Anganwadi workers, trained birth attendants, community health workers, doulas, and peer counselors. Key strategies to empower healthcare professionals in ensuring that every newborn receives the life-saving benefits of early breastfeeding include workshops, ongoing training, educational videos, printed guides, CME programs, and integrating lactation education into medical curricula. That concludes session 4B on breastfeeding the first hour after birth, where we discussed that comprehensive strategies are required to prioritize education, support, and infrastructure to enable mothers to initiate breastfeeding effectively, regardless of their circumstances or location. This can be done by ensuring access to skilled healthcare providers, implementing breastfeeding friendly policies in healthcare facilities, and providing lactation support. In the upcoming session 10, titled Breastfeeding, Maternal Nourishment, Health and Fertility, we will understand how a mother's nutrition, illness, and even family planning choices can impact her and her baby. We will explore how to nourish and care for mothers while ensuring the best start for their infants. We encourage you to continue sharing your thoughts, questions, and suggestions for future topics to help us better support your learning journey. Feel free to reach out via email at rajinder_gulati at hotmail.com. Your feedback is invaluable as we strive to create informative, helpful content. Thank you for joining, and we look forward to continuing this journey together. Have a wonderful day.